Hello, and welcome to our YouTube channel. In today's video, we're delving into the world of total hip replacement, a procedure also known as THR or total hip arthroplasty. This surgical intervention is a game changer in the field of orthopedics, offering a lifeline to individuals suffering from advanced degenerative hip osteoarthritis and various other hip conditions. First, let's break down what happens during a total hip replacement. It's a surgical process designed to remove damaged bone and cartilage in the hip joint and replace them with prosthetic components. Not only is THR known for being consistently successful, but it's also a cost-effective solution for many patients. Clinically relevant anatomy. Understanding the anatomy of the hip is crucial. The hip is a remarkable ball and socket joint that allows for a wide range of movements. Normally, the head of the femur and the inside of the acetabulum are cushioned with a layer of hyaline cartilage. However, when this cartilage is damaged, typically due to conditions like arthritis, it exposes the underlying bone, resulting in pain, stiffness, and even the potential shortening of the affected leg. The primary goal of THR is to replace these damaged surfaces, alleviating pain and stiffness, and enabling a return to an active and pain-free life. Indications for THR. Now, let's talk about when total hip replacement is recommended. The most common reason for this procedure is hip osteoarthritis, but it's not the only one. THR can also be considered for individuals who have experienced traumatic injuries, particularly femoral neck fractures in active and healthy patients. Other indications include osteonecrosis of the hip, often referred to as avascular necrosis, developmental dysplasia of the hip, and cases where there's hardware failure after internal fixation of hip fractures. Complications and improvements. While THR has a high success rate, it's essential to be aware of potential complications. These can be broadly categorized as systemic or procedure-specific. The good news is that over time, the incidence of complications has improved thanks to advancements in surgical and anesthetic techniques, along with better diagnosis and management. Systemic complications may include deep vein thrombosis, but the most dreaded complication in the world of THR is infection. Additionally, it's worth noting that leg length discrepancy is a common issue, which can lead to patient dissatisfaction. Contraindications for THR. Lastly, it's crucial to understand when total hip replacement might not be the best course of action. We call these contraindications. They include cases of septic, infectious, arthritis in the affected joint, active and ongoing infections elsewhere in the body, or severe peripheral vascular disease. These conditions may increase the risks associated with the surgery. And there you have it, our deep dive into total hip replacement. We hope you found this video both informative and educational. If you enjoyed this content, please show your support by hitting the like button and consider subscribing to our channel for more engaging medical insights. Stay tuned for more captivating topics in the world of medicine. Thank you for watching.